now we're going to apply gauze muzzle to our dog model. We need a pretty long piece of gauze. This is a little too stretchy, but we'll use it today. You can tie a knot to help give that gauze a little bit of weight so that it hangs down for you. The first step is that you're going to make your loop. So now we have a nice loop. This loop is going to go over the dog's nose and under his chin, so you can kind of adjust the size to your dog. Again, we can reach behind, sometimes you can reach in front. We want to tighten this up. It's a little harder on the model. So pretty far back, and then we're going to tighten that down pretty tight so that it's nice and snug. We're going to reach under, we're going to crisscross. We're going to take our two ends and pull them up behind the ears just like we did with our nylon muzzle, and then we just tie this in a bow. So now we have our dog muzzled. When we're done, we can just reach and untie our bow. And then oftentimes you could just pull on one corner and it will come off, but sometimes the dog just reaches up with his paw and he just paws that off for you. And just to review the gentle leader, take a few minutes to review the video that's online. But he's wearing his gentle leader. Again, it should come from about the medial canthus of the eye, and it should be loose enough to reach out to the back of it, or the base of his nose. It's not too tight. This strap should be very snug up behind his ears, so that I really can only get one finger under there. If you look at it from the side, it should look like a V. So if I wanted blood from his jugular vein, again, being at the end or the edge of the table is helpful. I can hold him again with my forearm against me. If I want jugular, ideally we could take off this leash. And now I can hold his head up. I can make it as high or as low as I need to by using my thumb and my finger to adjust his head position. Now this dog has a good disposition. His body language tells us he's pretty okay. If he were a little grumpy, we could put a muzzle on him, or if he were really upset about this, we would have to choose a different form of restraint. Now we're going to place this dog in lateral restraint. And remember, most dogs are a little uncomfortable. It feels a little scary for them to be in lateral restraint. But I've lowered my table so that it's low enough that I can reach over him. If you have a really tall dog or you can't lower your table, you would probably have to do this on the floor. I have him pulled close to my body, so he's leaning on me. And I'm going to reach over him with both of my arms. I'm going to take my hands and I'm going to hold the legs that are closest to my body. I'm not going to hold these legs, but I'm going to hold this leg and this leg, ideally in front of both of them. If you come behind this leg, that will work, but then you have to readjust your arm once they're in the lateral position. So I'm going to grasp both of his legs. And again, he's a little scared. And I'm going to lower him gently to the table. And now I have both the legs that are down so he can't get up, and my forearm is in position over his neck. So now he's restrained in lateral restraint. I can lean my body in if I need to against his back so he can't push away. If he were much bigger, this would be a two-person job where one person is going to take the front leg and the head and neck, and another person is going to take the hips and the back leg. But I want to hold on to this down leg because when he wants to get up, this is the leg he's going to push down on the table and try to raise his head up. From here, we can perform, if we needed some ultrasound or if we needed some other diagnostics, we could do that. Often you can let go of this back leg depending on how they respond to that. He doesn't like it very much right now. So we're going to apply a nylon muzzle to our dog model. The first step is to make sure we have it loose enough that it will go around his head. We can get him into a sitting position. Then we're going to hold our muzzle. We're going to reach from behind and we can slide it on. We want to pull the muzzle up close behind the ears, then we can buckle it together. Then we want to tighten this down pretty snug up behind the ears so that maybe just one finger at the most could go between there. Again, this won't have to be on for very long. And our goal is that he can't paw this off. Remember not to put your muzzle on upside down. So the longer, wider part is not the top, it's the bottom. And if we put it on upside down, we often get it in their eyes, and that's really uncomfortable. Usually the tag is on the bottom, not always, but remember when you're looking at the muzzle, the shorter portion is the top over the nose, the longer portion goes under the chin. You want to place it on from behind, you want to buckle it, and then you want to tighten it so that it's pretty snug up behind the ears. So we're going to review restraint in a live animal and a dog. So the first is I can assess his body language, and I know he's maybe a little nervous, he's panting, but overall he's pretty happy, pretty content. He's wagging his tail, he is not staring at us, he is looking around, he's alert, not hiding, not growling, not showing us his teeth, anything major like that. To pick him up, I'm going to squat down. And then I'm going to lift him by bending my knees. I have my hand under his bottom back here. You can reach under their abdomen, but sometimes that squishes their abdomen a little bit. So you can scoop them like this or like that and have my other hand in front of his chest. So for standing restraint, I can put one hand just behind his ear and I can pull him close to me. I can have a hand under his abdomen. Sometimes you can reach over their abdomen or their chest. Sometimes I feel it's easier to reach under. Depending on the dog and what's going to be done to him, we can restrain tightly or loosely. With him, he's pretty comfortable. But if we wanted to take blood, I could reach with my forearm and my hand, and I'm going to just pull his head close to me. I'm going to hold him tight, kind of just behind the ear. If I hold back here, he can still move his head. But if I move my hand and hold up here, I have more control over his head. So at this point, we can finish our physical exam. If we wanted him to sit, we could ask him to sit. We're going to sit. If he doesn't want to sit, we can help him. We can kind of scoop and help him sit down. If he still doesn't, after you scoop their back legs, you can apply a little bit of pressure over their hips. But now he's in a sitting position. Again, I'm going to hold the same way with my right hand around his head so I have good control just behind or just over the ear with my elbow kind of under his chin. And I can again use this arm to pull him as close to me as he needs to be to restrain as tightly or as loosely as possible with this arm. He's actually leaning on me. But now, if we needed blood from his cephalic, I could use my left hand to reach in just at that elbow, and I'm going to roll from medial to lateral. So I'm going to apply pressure, and I'm just going to twist my hand from medial to lateral, and I could give my veterinarian or technician this leg. So now I have his head restrained, I have his cephalic pulled off, or held off. Another thing that would help is if I took him to the end of the table. So now, whoever was taking blood from his cephalic would have more room for that. Okay, now, so for a sternal position, we can ask him to lay down, but today I don't think he's going to do that. So, for dogs that don't want to lay down, that we need a sternal position, first we have to have them sitting, and he's already sitting. Then we can take their front legs, and we can gently kind of pull those out in front while we just gently kind of lean on them and put some pressure on them. So now he's in a sternal position. I am using my body just to lean on him a little bit. I'm going to use my right hand, and I can restrain his head, again, as little or as much as I need to. If he tries to stand up, we can kind of start back over, and I can kind of lean on him a little harder this time. So again, if we wanted jugular venipuncture, I could hold his head the same way. Ideally, he should be a little closer to the end of the table. I can use my thumb and forefinger. I can use all my fingers behind his mandible just to reach up. I just want to be careful that I don't have my fingers too close to his mouth, or that I have him muzzled if I'm worried that he might snap. I can restrain his head again just behind the ear, and I can again reach with my thumb from the medial side to the lateral and just twist my wrist to roll that cephalic out, and I can give my veterinarian or my technician his leg so that they can perform cephalic venipuncture.